and welcome to the April 29th edition of the Situation Report for Thunder Bay Regional Health Sciences Center's COVID-19 response. My name is Tracie Smith, and I'm here with Dr. Kennedy, who is Incident Manager for our hospital. Dr. Kennedy, what is our current status with COVID-19 positive and presumptive patients here in our hospital today?
Well, overall, Tracie, we're looking pretty damn good. I must say, the hospital right now has one confirmed case in hospital, and that individual is doing quite well. Certainly are hoping for discharge in the near future. Not in ICU, out of the ICU now, and doing well. And we have 27 presumptive cases, that's a bit of an increase that we've had in the hospital over the past little while as far as presumptive cases. But we're doing more testing. Our index of testing has increased. We're doing one symptom now, and those symptoms even have expanded to just some nasal congestion or a hoarse voice or difficulty swallowing, because we noticed that COVID-19 is presenting differently all the time, and we want to make sure we stay on top of it and we still prevent COVID-19 coming into this hospital. So 27 presumptive cases, but certainly the reason for that is not an explosion in the community, it's more we're doing more testing.
So that's a really great news story when you're talking about that one patient, because that person was in the intensive care unit, improved condition, was able to move from there to the COVID unit, and now you're looking at possible discharge.
Yes, I think that is successful, and even more successful. At one point in time, we had more COVID-19 patients in hospital. They have been sent home. Unfortunately, one has passed away, as we reported last week, but a number have been sent home also in an improved condition.
That is wonderful news. Now, you mentioned more criteria for screening and for testing based on the evolution of the virus and its symptoms. Will that apply to enhanced testing for vulnerable populations here at our hospital?
Yes, we do have immunocompromised patients in this hospital all the time. One of sort of our high-risk groups is our renal patients who are undergoing hemodialysis, as well as our cancer patients who are undergoing sort of active treatment. So we're going to be screening them on a more aggressive nature. Not all cancer patients or renal patients will be screened. Certainly the symptomatic ones will be screened, and certainly the ones who are in long-term care homes and getting treatments here will also be screened. And also, if the physician has a higher index of suspicion with these immunocompromised patients, they'll also be screened according to the physician guidelines, and also following medical guidelines and directives that we have established. So a lot more being screened. Also, outpatients. I said previously last week, if we have an outpatient who's coming to the emergency department and sent back home to a homeless population or a shelter home, to a retirement home, they're also going to be screened, because we do not want to introduce COVID-19 into the vulnerable populations that we have here in the city.
And so the turnaround times for testing, I understand the backlog in the lab in Toronto is reduced, and so our turnaround times are better?
Our turnaround times have stabilized. It's still about 2 to 3 days. But in our high-risk population, if we're going to send them back to the community, they qualify for a priority testing, and we can get that done here in the hospital, and it just takes 2 or 3 hours to report back. So we're really looking aggressively to make sure we do enough swabs, enough testing on our population to make sure we continue to protect the hospital and other vulnerable populations.
So this level of protection is really key. And I know the government is planning a stage-by-stage approach to reopening the economy and ensuring appropriate measures are in place so that workplaces can open safely. Does that approach align with our hospital's planning?
Absolutely. We've been planning for the past several weeks to begin to look at potential surgeries that have been canceled and potential surgery, sort of outpatient types of procedures that have been canceled. Right now, we know provincially there's been a 34% decrease of cancer surgeries across the province. And as you know, all cancer has to be treated on a priority basis and priority factor. We have had to delay some of our sort of really priority surgeries because of COVID-19 and make room for both in the operating room and the intensive care units for any potential influx. But we've been really, really good at preventing COVID-19 in this community. So now we need to begin to look at addressing the population with the highest priority. We need to look at high priority surgeries, high priority procedures that screen for different types of potential disease. So we have to look at our diagnostics, our MRIs, our CT scans, our endoscopies. We have to look at what type of surgery has to be done, should be done on a priority basis, so our patients aren't left alone wondering when their next procedure is going to be. So that's sort of a big step. And looking at the government's sort of objectives about when to get moving again, we're in good shape. They're looking at virus spread and containment. Right now, we have a decreased number of hospitalization. We really haven't had very many. We're also looking at, we have enough critical supply right now in our hospital. That includes PPE. And certainly the health unit is really sort of well situated to trace down or search down any of the contacts in potential sort of COVID-19 cases. So we're really good in position in this Thunder Bay to begin in a methodology, so with good methodology, low risk, to actually begin to increase the required surgery. And if we do get a potential second wave or sort of an outbreak, we also know that we can actually ramp those services back down. So we're planning for that and hopefully begin that over the next a week or so.
So similar to what the province of Ontario is looking at, our ramp up and any need to ramp back down is based on criteria and what's happening in the community and in our hospital as opposed to specific dates.
Exactly, but we are sort of beginning to increase our priority surgeries next week, okay? And so we're moving ahead on those really high priority surgery next week that have been delayed 3 or 4 weeks already, that can't be delayed anymore.
That's good news for those people who are waiting.
Yes.
So with all of this talk of recovery, people may be tempted to relax their practices. Of course, we're asking people to stay the course. What are your thoughts on this?
Oh, absolutely. I mean, the reason we've done so well is everybody in Thunder Bay have stayed the course. And certainly, and we need to continue with staying the course, which means staying at home, doing your physical distancing, sort of making sure you're not bringing disease into the hospital. And also into our long-term care facilities, we still have to restrict our visitors. Right now, the Ministry of Health has assigned acute care hospitals throughout the province certain retirement homes to have oversight for, as well as certain long-term care homes. So it's a coordinated approach to make sure that, again, long-term care is taken very good care to prevent any type of breakout in these vulnerable populations. So we're working with the long-term care facilities, with public health, as well as Ontario Health North, to see what capacity we can assist long-term care in help prevention of any type of breakouts or influx of COVID-19 into these units. And they've done a remarkable job already. And so far in Thunder Bay, we've had no cases of COVID-19 in our long-term care facilities, our retirement homes, and we want to keep it that way.
Absolutely. Well, that's another really good demonstration of how collaboration is helping to get us through this. We're all in this together, as we know.
We sure are.
Great. Okay, well, keep up the good work out there in the community then, and we'll talk to you again soon.